So, good afternoon, everybody. Ladies and gentlemen, let me welcome you to our webinar dedicated to application of big data analytics on healthcare domain. This webinar is a part of cooperative project CHEDTEB, which is supported by the Erasmus Plus program of the European Union, and it's mostly about the cooperation between the universities. And one part of it is also dedicated to big data analysis and cooperation in this field. I am glad that I can welcome you all to this small event, and I think that just in a few minutes we are going to start. My name is Jan Luhan, actually, and I think that quite a lot of you knows me quite well. And I would like to also welcome Professor Sherif Sakr from University of Tartu, who will be our key speaker for this topic. And I think that he has prepared quite interesting things and topics and information about big data analytics in the domain of healthcare.
So we are going to talk today about some applications of the big data analytics and data science in the healthcare domain. So healthcare is one of the fields that have huge amount of data. In the last few years, we have been almost everywhere in every country we have been seeing a big advancement in moving from paper-based record to electronic-based record, and we are now in the era where the data storage is cheap and large, and our world has been just becoming digital in every domain, and healthcare domain is one of the domains where big data is penetrating this area and becoming one of the big players in this domain. So one of the most important characteristics of the data in the healthcare domain is that they are time oriented and they are diverse. They come from different sources, for example, from medical records, from insurance claims, from patient portals, from billing, from the IT systems and medical devices used by the healthcare providers and the patient, and from the healthcare applications as well. And currently we are seeing many phenomena which are pushing the data generation in the healthcare domain to a different level. So wearable devices, medical devices, wearable wireless medical devices sales are increasing, and almost now, most of us have somehow in our mobile devices some embedded sensors that monitor some physical characteristics about ourselves. Images has become also a very important data source in the medical domain. Now all healthcare providers using picture archival and communication systems, PACS, and they store different types of images. And actually the statistics shows that 80% of the data which is stored in healthcare by any healthcare provider is just images with its different types like X-ray, MRI, ultrasound, CT, and others. And in practice, the processing of medical images is very challenging, because the main challenge with the image data is that it's not only huge, but it's also highly dimensional and complex. And the extraction of the feature extraction from such type of data is really a complex task, and it's not an easy task. And many research work now is applying deep learning on medical images to extract the most relevant images and do automatic diagnosis. And the deep learning of medical images is now doing a very good job, just because the size of the medical images has become large and big enough so that deep learning can do a good job. Genetic data is also an important source of medical data. So the human genome program in any big country is now advancing, and each country have its own biobank and the genome project to collect DNA sequences about their population. They have been working in one of this program in the Saudi country. It's called the Saudi Human Genome Program, which we have been collecting around 10,000 DNA sequence at the first stage, and currently this number is now increasing, and that is a huge source of data. And the main reason of this continuous increase in collecting genomic data is the huge drop cost in sequencing a human genome. So in around 2001, sequencing one human genome was around $100,000, and now it's just a few $1,000s. It's like, yeah, you can just sequence a human genome by $3,000 to $4,000, and the cost is still decreasing. So in general, healthcare is a potential industry for big data, and there are a lot of applications that can be done in this domain to achieve different types of advantages, which we are going to talk about in the next slides. So in general, big data analytics is, we don't apply just to apply it. We just apply it because we need to reward us. And in the healthcare system, there are three main goals for any healthcare system. First is to improve the health of the population, to have a better health service. Second is to improve the individual patient experience of care. And third is to reduce the per capita cost of healthcare. And to reduce the per capita cost of healthcare, that doesn't mean actually budget cuts. That doesn't mean that if I spend 2 billion in one country that I would like to make them 1.5 billion. Actually, the budget of healthcare is always increasing, but to make it more efficient. So instead of using this $2 billion to treat X patient, I would like to treat 2X patient by being more efficient, or reducing the waiting queue, or doing more surgery operations. So here, that is the meaning of reducing the cost of the healthcare. That's why one also of the important trending directions now in the healthcare domain is what's called precision medicine, that we have personalized, data-driven preventive care for people using the availability of the genomic data and the big data analytics techniques. We can now make a personalized treatment plan for every patient. So data-driven decision is a key player here. We need to have the raw data and analyze them to reach an insights, and based on this insight we need to make action, and this action are mainly data-driven decision. Based on the analysis of the data we can make our decision. So in the healthcare domain, there are different business value of applying data analytics. The first of them is to save lives, reduce errors, and optimize the time, reduce the cost, increase the efficiency, improve the patient outcome experience, and management as well. So what is healthcare analytics? Healthcare analytics is defined by HIMSS as a systematic use of data and related clinical and business insight developed through applied analytics techniques to drive fact-based decision-making for planning, management, measurement, and learning. And the main goal is to provide improvement to the clinical outcomes of patients via treatments and the protocol, and also promotion of wellness and disease management. So just to make it short, to gain insight for making informed healthcare decisions.